checked. I'm joined now in the studio by Niall Dickson, co-chair of the Brexit Health Alliance, the group that monitors the effects Brexit will have on the NHS. I mean, Niall Dickson, there can be few areas perhaps that cause as much concern as the prospect of what might or might not happen with a no deal, say. Where would you say things stand at the moment?
Well, the first point, which I think a lot of people don't quite understand, is just how dependent we are and how interdependent the whole healthcare supply chain is. So even for one drug, you can have chemicals that will cross 3 or 4 borders. Out of the UK every month, 45 million packs of medicine leave the UK to go to Europe, and 35 million come the other way. As we've just heard in relation to something like insulin, we are actually very dependent on Europe to get that through. So the government, not before time I have to say, has recognised that if we are going to have a no deal, we've really got to start planning, and we've got to start planning effectively. It may be acceptable for cars to sit around in Calais for a week or so while things are sorted out. It's simply not acceptable for medicine. So that's why planning is right. I
mean, you mentioned the insulin story, as it were. The UK drugs regulator raised real concerns about that last week because we don't produce very much of it, hardly any in terms of the insulin that's used by diabetics. The regulator says he's now convinced the government has a handle on that particular issue. Are you convinced by that?
Well, we've had quite a lot of discussions with officials. There was a while when the government really didn't want to talk about no deal at all, about any preparations for it. I think there is now recognition across government that we need to plan for a no deal. In terms of healthcare, for us, I mean, it has to be the #1 priority. For patients, this is a matter of life and death. Therefore, good planning and common sense can get us round this. I don't want people to start panicking, because that's not the thing to do now. But it does mean that the government has to start thinking about stockpiling, maybe 4 to 6 weeks of supplies in certain cases. And it's certainly the case that NHS organisations must now start to look at their own supply chains. What drugs do they get? Which ones are they very reliant on Europe? They need to get all that stuff sorted out.
I mean, how is that being organised? How many people within the NHS are now working on those plans?
Well, I think the answer is we're at the start of that process. We do know that...
Which will seem late to a lot of people.
Well, we are still some months away. The reality is, of course, that a lot of NHS stuff, like the rest of industry, is just in time. So things arrive for an operation the day before the operation. So you've got to look very carefully and say, well, if we had a no-deal Brexit, what happens on the 1st of April? How many of those things would be affected? Some will not be. Some will come from warehousing that is already pretty full anyway. They will come. But we need to understand in detail what is going to happen in terms of critical supplies that affect people's lives.
So if you take the insulin example, for example, I mean, how feasible is it that we would start to manufacture our own insulin, the quantities needed?
I don't think that is the answer. The answer is we need to come to a sensible deal with the rest of Europe, even with a no deal, in terms of ensuring that we get constancy of supply.
And how much sort of communication is there between your organisation, the NHS, and the government on this at the minute? How closely are you working together now?
Well, I think certainly on this issue, we weren't working closely together. We are working closely now. So we are aware that there is significant planning going on within NHS England and within the Department of Health. We have to see the results of that.
Would you say that the government failed to take this seriously enough up until this point?
I think the government took it seriously. I think officials took it seriously. But politically, it wasn't acceptable to look at it. And it is acceptable now.
Is it possible to say how much this is going to cost the NHS?
No, I don't think we do know that. And I think individual NHS organisations do need to look at what are the cost implications of these changes. There are longer-term effects of a Brexit without a deal on NHS organisations. We need to look at that for things like research funding. But the immediate cost, we do need to look at that too.
Niall Dickson, the co-chair of the Brexit Health Alliance, thanks very much for joining us.